Thank you for joining us for this brief introduction to our poster on mental distress and substance use among rural African youth who are not in employment, education, or training, also known as NEET. Youth unemployment is a global challenge that can leave youth at an increased risk of mental disorders and risk-taking behaviors, such as substance misuse. South Africa has one of the highest youth unemployment rates in the world, with 40 million young people, 15 to 29 years old, not in employment, education, or training, even before the COVID-19 pandemic. The objective of this study was to compare the rates and severity of psychological distress and substance use between the youth who were in employment, education, or training versus those who were not. The study took place in a sparsely populated, deep rural area with high rates of multidimensional poverty and limited opportunities for employment. Using quasi-probability cluster sampling, we recruited 355 randomly selected young men aged between 14 and 24 years. Data were collected in the widely spoken local isiZulu language using the AKASI, that is the audio computer-assisted self-interviewing system. We used the brief symptom inventory to assess psychological distress. Using chi-squares and analysis of variance, we compared the NEET and non-NEET youth on psychological distress symptoms and substance use, and among the 15 to 19-year-olds versus the 20 to 24-year-olds. Overall, we found that being out of employment, education, or training places a high toll on mental wellness and increases the risk of substance misuse. Just over half of the youth in the study experienced symptoms of depression. About half reported feelings of worthlessness, and 63% reported feeling hopeless. On the other hand, high rates of anxiety and suicidal thoughts were reported by both groups, and this underscores the known high rates of these disorders in the general population in this area, particularly among young men under the age of 24 years old. 1 in 4 participants in the study reported having suicidal thoughts in the previous week. When we compared the older age group, that is the 15 to 19-year-olds, with the 20 to 24-year-olds, the older age group reported more severe psychological distress across the board. In conclusion, these findings highlight the significant human toll imposed by the inequality of opportunity on youth and their loved ones in these communities. Thank you for your attention. Please feel free to connect with us on social media, and the contact information is on the poster. Thank you.